Welcome back. Many healthcare workers are being pushed to the breaking point as they work on the front lines battling the coronavirus. On Sunday, a top New York City emergency room doctor took her own life. NBC's Stephanie Gosk has more on the tragic story.
Overnight, new reaction to the tragic news that shines a light on the overwhelming impact of the coronavirus pandemic. Dr. Lorna Breen, an emergency room doctor at New York's Presbyterian Hospital, took her own life. Her father telling NBC News she was, in every sense of the word, a hero who gave her life for her friends and city. Breen's father, also a doctor, confirming his daughter had contracted the disease and survived it. But she had described devastating scenes of the toll the coronavirus took on patients. She tried to do her job, and it killed her, her father told the New York Times. She's a casualty just as much as anyone else who has died.
And joining me now is Dr. Jessica Gold, assistant professor in the Department of Psychiatry at Washington University in St. Louis. Doctor, thank you for joining us. You know, just listening to that piece right there and that description, I mean, that sounds like the kind of story you get coming out of a war zone where people just see unspeakable tragedy all around them and just become overwhelmed trying to deal with it. It seems to drive home there. That's in a lot of ways what this is.
Yeah, thank you so much for having me and for having this conversation. They use the analogy of war zone because it is really different than what doctors are used to experiencing on the day-to-day job. What people are seeing is different. It's hard. We've been seeing a lot more death. We're seeing a lot more infection. So doctors are scared that we're going to get sick, that we're going to infect our families, that we're going to die. It's not something doctors think about very often. We're afraid that we're not protected with protective gear, which is something that we are used to having and are taught that we should be having. And that is something when you go into a quote unquote battlefield without, it can feel like anxiety provoking. It can feel trauma provoking. It can feel depressing. It's just not something we're used to. So you're right. It's very different.
Well, healthcare workers have been sharing their experiences and concerns with us online. Here are a few of their responses.
I have a 4-year-old, a 6-year-old, and a husband at home. That's one of my biggest fears. I drove home that night, that first night, and I just cried because I really couldn't fathom the thought of bringing COVID home and exposing my family to that.
My patients today weren't, these elderly people. You see a lot of people who aren't that far off from my age. It's hard not to be scared. It's hard not to let that get to you.
So you really see and hear there those fears that you were describing there, some of those fears that healthcare workers are facing here. What advice, whatever the specific fear is, whatever the specific anxieties, what advice do you have for healthcare workers who are dealing with it?
Yeah, you're right. You can hear it in their voice. It's really heavy when they speak. It's almost like palpable when they talk. I mean, I think the first thing to do is really to let yourself feel. Healthcare workers are really used to being stoic. We don't like to talk about feelings, almost taught to not talk about feelings. So the first thing we need to do is allow ourselves to feel, give ourselves space to feel, talk to our friends and family if we can. If that's not someone we feel comfortable talking to, reach out for help. There's help that exists. There's help for people like me, and we want to help you. And I think that's not something we're used to doing. We're used to putting the mask on other people and really, really focusing on helping others before we help ourselves. And we really need to do both right now. And that's hard to do, especially when the day-to-day is filled with so much adrenaline that we can't stop and focus on ourselves at all. And we need to do both to be able to keep going and to want to keep going.
And for members of the public just wondering what they can do to help, what's the advice there?
Yeah, I mean, I hear from friends and family and a lot of my patients who are also healthcare workers that it has been really nice, those little things that people have been doing, like showing up and thanking healthcare workers and sending cards to people that are healthcare workers or texts and things like that. So please keep doing that. I think know that sometimes we can't tell you our stories, and sometimes we can't be the narrators because it is hard for us. I think that it is hard to be the people who are always telling you what's going on inside the walls of the hospital. And that's actually trauma provoking for us at times. And I think people ask us because they care. And sometimes we just can't tell, and know that's not because we don't know you care. It's just hard sometimes. Keep that in mind. I think there are ways to volunteer. Some hospitals have ways to donate PPE. Some places like getusppe.org is an organization that my friend started, and that's a really great place to donate to and get involved with. That's a great way to get involved. The crisis text line has a Frontline worker specific line, and I know that they're always looking for volunteers, so you can look up the crisis text line and try to get involved.
All right, Dr. Jessica Gold, thank you for joining us. And we want to let you know that if you or someone you know is in crisis, you can call the National Suicide Prevention Lifeline. The number is 1-800-273-TALK. Be right back.